understand that, according to our understanding, one of basic lineages, one of basic stages, grades of maturity of stem cells is multi-potential hematopoietic stem cell. Multi-potential. This means that any blood cell may generate from this one stem cell. This stem cell has the ability to regenerate. In other words, it may not only divide and undergo some measuring process, forming other cells, but it also may divide and produce same blood cells, same stem cells. It has the ability to reproduce itself, and it is very important. According to our understanding of the matter, the next level of maturity of stem cells, hematopoietic cells, are two of them. Common myeloid progenitor cell and common lymphoid progenitor cell. What does this mean? This means that almost any blood cell, myeloid blood cell, including platelets, including red blood cells, any leukocyte, with the exception of lymphocyte, may grow from this common myeloid progenitor cell. The other branch of hematopoiesis is conditioned by common lymphoid progenitor cell, and only lymphocytes may develop from this cell. What is important in this relation? These two cells may also reproduce themselves. And we name these two levels of hematopoiesis, or prebiotic approach, as blasts. One of the important capabilities of these cells is to reproduce themselves and be a progenitor of other cells. Starting from next level, there are progenitors of appropriate lineages of blood cells. For example, megakaryocyte, mega, big karyos, nucleus, cellular nucleus, cyte cell, a very big cell, and its portions form thrombocyte. Later. Next, progenitor of erythrocytes. Yes? Sideroblasts, erythrocytes, including reticulocytes, including red blood cells with basophilic seedling and other growing, maturing layers or levels of this lineage, including mast cell, lymphocyte, including myeloblast. Regarding of the name blast, this cell cannot reproduce itself. It may only grow to other cells. Following cells are grown from myeloblast, basophile, neutrophils, and if you remember, including stem cell, including segmented cells. They also subpopulation from this lineage. Eosinophile and monocyte and macrophage. Yes. If we are speaking about lymphoid lineage. The next level of the common lymphoid progenitor cells are progenitor of T lymphocytes, natural killer cells, and lymphocytes. And lymphocytes are subgroups into T lymphocytes and B lymphocytes. Let's come back. Why this is important to remember? Because if anything happens with, maybe I'll clear all this, if anything happens with pluripotent or multipotential hematopoietic cell, what happens with the hematopoiesis? With blood, with organism, what happens? Can these cells be productive and circulate and conduct their function? No, and neither. Yes? So this is the most dangerous situation. If this happens, if this happens in pre-birth stage, this leads very quickly to death. Next, what happens if there is mutation, something happens with common myeloid progenitor cell? Will these cells be productive and conduct their function? Not. Everything is affected with the exception of what? Lymphocytes. And there will be what? Compensatory lymphocytosis. Many natural killers, many T and B lymphocytes, and they will try to replace the function of neutrophils, yes, these, and try to struggle against infections, invasions, everything. Mutations in the organism, what this might lead to. As soon as erythrocytes are not productive in enough quantity and thrombocytes, so if there is a lack of thrombocytes, there will be hemorrhages. Yes, hemorrhagic syndrome. If there is a lack of erythrocytes, there will be what? Anemia. Anemia. What kind of anemia? We discussed 5 types of anemia. Sorry? Are there any other conditions besides hemolytic? Of course, hypoplastic and aplastic. But I could agree with you partly. The first is hypo and aplastic. Hypo and aplastic anemia. But if there is overproduction of natural killers and T cells and B cells as well, lymphocytes in other words, there is a risk. And there is a risk of cross-reaction, immune reaction to cells, to red blood cells, and this also may be associated, they could be combined, hypoaplastic anemia and hemolytic as well. But the first is hypo and aplastic. Understand this and remember. If there is a lack of mast cells, same situation, there will be problems with what? Quick, immediate response, allergic response, immune response, non-specific one. If there is a lack of all these neutrophils, basophils, and so on, there is a problem with what? Non-specific immunity. Yes, non-specific immunity. So, I clear again, what happens if common lymphoid progenitor cell will mutate, will be affected? Lymphocytes will not be productive in enough quantity. All the rest will be okay, will even increase in quantity, in function, and try to compensate specific immunity. Can they succeed with compensation of specific immunity? No, and neither. But if we compare the danger of myeloid progenitor cell mutation and danger of lymphoid progenitor cell, this one is much more benign. This is better, in other words. And usually it takes much more time to develop the disease. If the prognosis is much better, treatment is much more accessible, has a better result. Okay, so what happens if there is a long-standing mutation of growing, maturing cell only this lineage, only on the level of myeloblasts. So there will be affection of basophils, neutrophils, eosinophils, and macrophages. Yes? There will be a lack of them, and lymphocytes will try to compensate this condition. Yes? There is no affection of erythrocytes and platelets. So, once again, this is also dangerous, very even dangerous, but if we compare with affection of two previous levels, it's much better. Yes? But anyway, this may be associated with rather severe infection result. What happens if there is isolated affection of natural killer cell progenitor? What will happen? Maybe there is some immunity disorder, yeah? There will be some acquired immunodeficiency syndrome, not virus associated. But maybe this will not be so significant because other cells will compensate. Yes? Next. What happens if there is affection of progenitor of both late ages of lymphocytes? Dangerous situation, much more dangerous than previous. Why? Because there will be lack of production of antibodies and problems with cellular response as well. Yes? Specific immunity will be significantly, more or less significantly affected. So, very rarely, but it is possible that some maturing cells are also affected. What do I understand by affected in this case? They undergo mutation. We will discuss these mutations slightly later. Maybe you know it better than me, but I have to discuss. When there is isolated affection only of basophils, no problem. Yes, only maybe eosinophils, not so significant. It is a problem, but it is not so significant. So, and the last idea I want to show you on this slide, if there is affection of blast cells, as we wrote here, yes, blast. We name this leukemia as acute. Acute. So blast, mutation of blast means acute leukemia. If mutation takes place in maturing cell, so these are maturing and maturing. We name this leukemia as what? Acute and chronic. Chronic. Try to remember this, just trust me. Regardless of clinical manifestation, of its intensity, of number of complications, and so on, we base our decision about the type of leukemia on cells, on the level of cells mutation. We will remind this on the next slide. So I just repeat this. Cells of first to third classes have no morphological features and they are named non-differentiated, what is important, blast. If you wish, you may make a Photoshop or write to the conspect. Non-differentiated blast, and if they undergo mutation and tumor progression, we name this leukemia as acute. If, leukemia, malignant, all of them are malignant, tumors of hematopoietic tissue with primary, what is important, primary localization in bone marrow and following dissemination are named leukemia. So these diseases, leukemia is a hematopoietic tumor or hematite tumor with primary localization in bone marrow. Why is it important? Because some of them will be localized in what? Lymph nodes, in spleen, in other locations, and they will be named by other names. Next. Etiology. Cause of leukemia. clearly associated with the danger, with the risk of leukemia development, including endogenic predispositions, genetic anomalies, and exogenic affection, including ionizing radiation, including chemical substances, and viral infections. Let's discuss this more detailedly. According to modern understanding of the mechanism of leukemia development, so-called clone theory was developed. Clone. The clone, the duplication of something, yes? Duplicate. Clone theory. What do we understand by this? What is understood by this? According to this theory, each case of leukemia passes following two main phases or stages. Benign, monoclone, monoclone, and malignant polyclone. So bad course monoclone. What does this mean? Monos means one, yes, clone, cloning, duplication. Only one mutant cell produces one leukemia clone. Why it is benign? Why it is better benign? Because all of the cells that are relatives of this mutated cell persist in similar or same cellular phase, and when we conduct the specific treatment, it is much more effective. There is no diversity in the forms of these cells. What happens later, polyclone, when it is a result of repetitive mutations of multiple different leukemia precursor cells, and they appear in different, of course, leukemia clones. In real cases, they could be even a combination of mutation of different lineages. For example, of myeloblasts, and there is a problem with what neutrophils, monocytes, eosinophiles and basophils, and for example, progenitor of B cells. Yes? It is polyclone. Even if this mutation happens in the same lineage, but in this case, in polyclone, there are different grades, there are different cells in different cellular phases persist in circulation, and we have a very big problem in treating all these patients. How all these develops? What is the connection between etiological agent and development of leukemia? Etiological factor influence directly on progenitor cells and conduct mutation of myeloid or lymphoid precursor cells. What is mutation? It is a change of genetic structure, and therefore, as a result of this, phenotype of the cell, its function, its morphology, everything. Besides this, apart of this, in each of our cells there are portions of genome that form the potential risk of malignization, of tumor growth. If each of us, in each of our cells, in skin, in muscles, in nerve cells, in anything, in connective tissue cells, including hematopoietic cells. So these genes are persistent inside the genome. But normally, these these fragments of DNA, the ribonucleic acid, are depressed. They are not active. Under the influence of etiological factors, either virus, which includes its DNA into DNA of the cell, or maybe toxic cancerogens, which also affect this DNA, or once again, ionizing radiation, these oncogenes become active, and it leads to mutation of the cell, its tumorous growth, and so on. On this stage, when etiological factor produce only one cell to mutate, or induce only one cell to mutate, we have benign monoclonal tumor growth. Only in one place, and usually it is localized growth of this tumor in most cases. In some rare cases, it will be not significant dissemination. Usually there is no metastasis. It is localized tumor. But if this person continues to undergo etiological factors, they continue to damage DNA. They produce multiple additional mutations, secondary mutations, and this leads to malignant tumor growth with proliferation of log differentiated cells and metastasis. Meta means some other place, stasis, state, stable condition. When these cells, tumor cells, appear in different tissues and organs across all the organisms, and so-called extramedullary foci of hematopoiesis appear. And this is one of most specific clinical symptoms of this condition from side of oral cavity as well. What happens else? Simultaneously with what we discussed with you before on previous slides, tumor growth may result directly into clinical and hematological signs. What signs? Appearance of extramedullary foci of hematopoiesis, metastasis. You may observe this in the skin, in mucous membrane, inside other organs. They may affect their function and so on. And hematological signs include what? Appearance of these blast or mutated measured cells in peripheral circulation and inside the bone marrow, if you take an aspirator. Next, leukemic infiltration of tissues, as it was said before, leads definitely to the disturbance of structure and function of appropriate organs and tissues. And this also leads to appropriate clinical manifestation. Displacement of normal hematopoiesis is one of the main mechanisms of anemia development in case of, for example, affection of myeloblasts. When there is displacement of normal erythropoietic foci inside the bone marrow with growing tumorous tissues, and hypoplastic anemia develops in this case. Next, immunity disorder. Due to displacement of normal hematopoiesis, there is problem with generation of what? Neutrophils, macrophages as first layer of immune defense. Probably there could be also problem with the generation, production of lymphocytes as well. And there is a reciprocal link to tumor growth. Why? Because normally, even now, while you are speaking, sleeping or listening to your teacher. In each second, several hundred cells in your and my organism undergo mutation. It's natural, it's normal. But all of these cells, I hope, are fought by macrophages, for example, as one of main cells that are responsible for antitumorous immunity. And as soon as there is a problem with immunity, these cells do not possess their function. Elimination of these tumor cells, and this elevates the intensity of tumor progression. Besides this, there is a problem with autoimmunity and predisposition to infection and chronic inflammation forms, and all these result in clinical manifestations. So, during the tumor progression in leukemia, there are following main points maybe on this pathophysiology, including depression of normal hematopoiesis, displacement of differentiated cells with blast, so depression and displacement, loss of differentiation. This is one of the main features of tumor cell as well. Formation of extramedullary pathologic hematopoietic foci, metastasis. It is not just dissemination of cells, and they simply persist via distal organs. They continue to develop, they continue to grow, they may continue to reproduce themselves, and this also forms a big problem, clinical problem. And finally, after some period of repetitions, mutations, dissemination, and so on, there is a resistance to treatment appears. What is the mechanism of this? These cells become so undifferentiated that our medication, medicines which are in on specific cells or specific phase of cellular cycle, then become not to be effective. Just imagine this. One leukemic cell, in 40 cycles, it takes about 3 months, may produce 1 kilogram of tumor mass. Only one cell. And we agree with you that this is benign form, if one cell is will be. If there are 2, 3, 10, 100, several thousand cells undergo mutation, especially blood cells of upper classes of hematopoietic cells, this leads to death in few days. This dissemination takes place very quickly. Maybe we'll discuss this classification and make a break immediately. So, the main approach to classification is based on morphological structure of mutated cells. In hematology, in so-called general hematology, there is a great variety of different forms of leukemia. Maybe I would be right if I say that there are hundreds of them, hundreds of different forms. We will not study each of them. Even more, we are going to generalize all this material in only 4 types, even not diseases, but 4 types of these diseases. Acute and chronic, lymphocytic and myelocytic, lymphoblast and myeloblast. So, in acute lymphoblast leukemia, acute myeloblast leukemia. Depending on what branch is affected, we simplify this matter, this material greatly, especially for you. lymphocytic. If you can see, in acute we name them blast, in chronic we name them cells, yeah? In lymphocytic. Chronic myelocytic.